These are the top 5 things we're seeing in the pediatric emergency department this week, in no particular order because every day seems to bring its own flavor of misery. Summer brings a lot of hand, foot, and mouth. You get a rash around your mouth, your hands, your feet, your booty, you get sores in the back of the throat. You can also have high fever, runny nose, cough, vomiting, diarrhea. It's pretty miserable. Treatment is generally supportive, and pain control is really important to ensure hydration. We need to see them in the emergency department if they're having a hard time breathing or getting dehydrated. Parainfluenza virus, it causes croup. These kids bark in the middle of the night. Sometimes they wake up out of nowhere and they just start barking. They're having difficulty breathing. A lot of times by the time you get to the ER, they look freaking fantastic. Treatment's usually a dose of steroids if they're doing better, and steroids plus racemic epinephrine if they're still having stridor or difficulty breathing. We are still seeing so much gastro. We're seeing norovirus, rotavirus, sapovirus, and astrovirus. Most of the time we don't need to test because it's Zofran, tolerating some oral intake and going home. We can't fix diarrhea, but if you're starting to get dehydrated, we do put an IV in, give some fluids, check some electrolytes, and sometimes have to admit to the hospital. Over the last 2 to 3 weeks, we're starting to see an increase in COVID-19 cases. The symptoms are pretty much the same as we've always seen: cough, runny nose, fever, sore throat, headache, body aches, fatigue, a little bit of vomiting and diarrhea. Most of these kiddos are not requiring hospitalization. And what feels like out of nowhere, we're seeing a ton of influenza B. And this really late in the season for it. Cough, runny nose, fever, these kids are miserable. We've had to admit some of them for difficulty breathing and dehydration. What are you doing? Do not bite me. Do not bite me. No, okay. Advancements in technology have allowed us to give the common cold and the common stomach bug a name. Nothing other than COVID-19 has changed over the last couple of years. These are pretty much the same viruses that we expect to see every summer. Testing is pretty expensive, so kiddos that are healthy and are going to be discharged home generally don't need it. It's reserved for kiddos that have underlying medical issues or need to be admitted to the hospital. Don't bite me. Say hi to your friends. Say hello.